I played one round of golf after the pain started significantly. Probably by about the 6th or 7th hole, we were walking and the twisting, it became pretty clear that it was only going to get worse. It was a constant local pain in my lower back. The pain would be so much that I'd stop.
He had a worn out disc at L5-S1, severely collapsed, so the gel that was serving as a shock absorber was no longer there. Ultimately, he underwent a minimally invasive fusion at L5-S1. He's one of many golfers that I've treated with the lumbar fusion, minimally invasive, that's returned back to play, and I think that his video and his golf analysis of his swing will demonstrate that. So someone that comes in with back and leg problems, if they're a candidate, then they'd undergo a golf analysis before their surgery, and then after surgery, they would once again return to Athletico.
We talked about those sensors being both for position as well as for speed. We're really fortunate to be teaming with Rush to do this study. So we're looking at everything from neck range of motion to shoulder blade strength to shoulder range of motion, core strength and endurance. We're looking at hip strength. We're looking at hip flexibility and hip joint mobility.
I think we also get a time and a sense for when these patients get back to how they were before surgery. So at least we can kind of then conclude when it's safe for these patients to return in some general kind of format that we can apply to golfers all around the United States.
The research field doesn't have a lot of good medical research on golf following injuries or following surgeries, especially from a return to golf from a spine surgery. So this study is really big, first of its kind, to really look at returning golfers back to participation in sport.
I would imagine there are many people whose handicaps are going to improve just because they don't have to worry about compensating for the pain. My recent swing was great. I was more worried about my specific technique. I wasn't even thinking about compensating for my lower back pain, worrying about adjusting that. It felt great.